Hey there everybody, this is Dr. St. Jean. Thanks for tuning in. In this video we're going to discuss some important concepts that you're going to want to consider in terms of how chiropractic medicine can potentially benefit women who are pregnant. First of all, low back pain is an extremely common complaint during pregnancy. And I'd say about half to about 3/4 of the women I see report back pain at some point throughout their pregnancy. And as you're probably thinking right now, most women are going to experience this pain in the second half of their pregnancy when they're carrying more weight around. And there's a variety of reasons why women experience low back pain during pregnancy, and these causes can range from, number one, altered posture, resulting in excessive pressure on the spine, altered posture. Number two, fluid retention. Number three, another reason would be joint laxity or looseness. The joints get loose. Joint laxity. And number four, the abdominal and pelvic floor muscles become weak. Weak pelvic muscles. The reality is, women have enough going on during pregnancy and they don't need to deal with low back pain getting in the way of things like getting a quality night's sleep, feeling good, having good energy levels, etc. Especially when this type of pain is treatable. So what do we do about it? There's a ton of evidence-based, effective treatment approaches available for women that are suffering from not just low back pain, but hip pain, knee pain, foot pain, you name it, throughout pregnancy. And these treatment options range from things like soft tissue therapy and chiropractic adjustments to hot packs and therapeutic relaxation exercises. Everyone always kind of wants to know about the validity, right, of spinal manipulation. Is it beneficial or is it hogwash? In the case of spinal manipulation in pregnancy, there's a good amount of research to support these adjustments. A lot of studies have indicated that women who have been examined and are in need of an adjustment have reduced need for analgesics or pain medications by up to 50%. And women receiving chiropractic care throughout their first pregnancy also reported a 24% shorter labor time. And those that were going through their second or third time reported 39% of shorter labor time. So that's pretty significant. There was another study too where women were receiving chiropractic care, including adjustments, and they experienced a reduction in back pain after an average of just 2 visits over a course of 4 days. There's really no serious side effects associated with adjustment for the mother or the baby if done properly, and patients have a high satisfaction rate, with up to about 84% of patients experiencing relief from pain. So you have to be examined first. And if it's found that you would benefit from an adjustment, it's definitely a safe procedure that you should consider because it can yield really, really good results. But what about soft tissue therapy? Soft tissue during the second trimester has shown to, number one, reduce anxiety. It reduces your anxiety and depressed mood. That's cool. It increases dopamine and serotonin, and it decreases your cortisol. Sorry, my handwriting's awful, but you get what I'm saying. It decreases your cortisol. What does all this mean? You simply feel much better. Pregnant women receiving soft tissue therapy also report not just feeling better, but a reduction in their pain. So as much as these passive treatments are really enjoyable, it's also important for us to engage in active therapies as well. Exercising through your pregnancy is going to increase your overall fitness, it's going to promote faster recovery from labor, it's going to improve your muscle tone, and it's going to help prevent low back pain, hip pain, knee pain, foot pain, you name it. So it's important for you to consult your healthcare provider before you initiate any of these types of exercise programs while pregnant. I'm going to share with you an exercise that's really, really beneficial, but again, don't do it unless you've been examined and it's been okayed by your physician. The exercise is called the quadruped. What you're going to do is you're going to start on your hands and your knees. You're going to keep the normal curvature of your lower back intact. Then you're going to extend one leg out into the back and try not to twist the body, especially your pelvis and trunk. We don't want rotation there. And then hold that leg parallel to the floor for about 5 seconds. Return to the starting position and just repeat 10 times on the same side. After that, repeat with the opposite leg. It's not too hard, but it's a really potent exercise in terms of low back pain. There's a ton more exercises we could talk about, ones that you benefit from, but you really need to be examined first, and care needs to be taken in terms of what exercises are prescribed for your individual body's needs. So outside of a therapeutic exercise program, it's also important for you to engage in at least 30 minutes of mild to moderate, ongoing, low impact exercise per day. So think things like swimming, stationary bicycle, brisk walking, all those are excellent options. This is going to really help contribute to normal on-time delivery and improve the likelihood of giving birth to a healthy baby. That's what we all want. So finally, one more treatment strategy I want you to consider is getting a pair of custom orthotics. Pregnancy triggers a wide range of changes in a woman's body, and the additional weight into the torso has immediate effects. Things like increased curvature in the lower back and a forward tilt of the pelvis causes problems. When a woman's center of gravity becomes altered, those weight-bearing stances also change. And this can cause increased demand on the muscles of your hips, the muscles of your legs, and your ankles. And these changes contribute to the characteristic posture and gait associated with pregnancy, where the knees start to move closer together and backwards, and the feet start to flatten and spread out from side to side. Those fallen arches are called overpronation, and it's associated with pregnancy, but it's best treated with a truly, again, custom-made, biomechanically correct foot orthotic. In fact, pregnancy provides an opportunity to address foot problems while your foot is malleable and able to adapt to a new position. Remember, joint laxity, that's an opportunity. So using the time while you're pregnant to support your foot in a new corrected position will allow proper functioning and decrease pain for years to come. So important. So as you can see, there are a variety of ways in which chiropractic medicine can help you throughout your pregnancy to stay out of pain and to sustain a high level of health. It's not always just about pain, right? It's much more. So this is Dr. St. Jean. I hope you found this information and video helpful and useful. Be well. I'll see you soon. Bye-bye.